Appendicitis. The word itself might conjure images of discomfort, maybe even a trip to the hospital. But what exactly is it? Appendicitis is an inflammation of the appendix, a small, finger-shaped pouch that projects from your colon on the lower right side of your abdomen. While not always a life-threatening condition, it requires prompt medical attention to avoid serious complications. Join us as we delve into the causes, symptoms, diagnosis, and treatment of this common ailment. So, what triggers this inflammation? The most frequent culprit is a blockage. This blockage can be caused by a variety of factors, including hardened stool, also known as a fecalith, parasitic infections, or even, in rare cases, tumors. When the opening of the appendix is blocked, bacteria can multiply rapidly inside, leading to the formation of pus and swelling. Less common causes can involve kinking or twisting of the appendix, or inflamed lymphoid follicles within its walls. Whatever the underlying cause, the end result is the same, a painful and potentially dangerous infection. Let's take a closer look at what happens inside the body. The initial obstruction prevents normal drainage, creating a breeding ground for bacteria. As these bacteria multiply, the appendix becomes inflamed and swollen. This inflammation increases pressure within the appendix, compromising its blood supply. Without adequate blood flow, the tissue of the appendix begins to die. If left untreated, the appendix can perforate or rupture, spilling infectious material and bacteria into the abdominal cavity. This can lead to peritonitis, a serious and potentially life-threatening infection of the abdominal lining. Appendicitis is a relatively common condition, affecting people of all ages. However, it is most prevalent in individuals between the ages of 10 and 30. While there's no specific demographic that's entirely immune, men are slightly more likely to develop appendicitis than women. The exact incidence varies globally, but appendicitis accounts for a significant number of emergency room visits and surgical procedures each year. Recognizing the signs and symptoms of appendicitis is crucial for early diagnosis and treatment. The classic symptom is pain that begins around your navel and then shifts to your lower right abdomen. This pain usually increases over a period of several hours and may be accompanied by tenderness to the touch. Other common symptoms include loss of appetite, nausea, vomiting, constipation or diarrhea, abdominal swelling, and a low-grade fever. Some individuals may also experience pain that worsens with movement, coughing, or sneezing. It's important to remember that not everyone experiences all these symptoms, and the presentation can vary, especially in children, pregnant women, and older adults. Diagnosing appendicitis typically involves a thorough physical examination and a review of your medical history. The doctor will assess the tenderness in your abdomen and may perform a rectal exam. Blood tests can help detect signs of infection, such as an elevated white blood cell count. Imaging tests are also commonly used to confirm the diagnosis. A CT scan of the abdomen is often the preferred method, providing detailed images of the appendix and surrounding tissues. Ultrasound is another option, particularly for children and pregnant women, as it avoids radiation exposure. In some cases, an MRI may be used if the diagnosis remains uncertain. While appendicitis isn't categorized into distinct types, in the traditional sense, it can be classified based on its severity and stage. We can consider terms like uncomplicated appendicitis, when the appendix is inflamed but hasn't ruptured, and complicated appendicitis when perforation has occurred, potentially leading to peritonitis or an abscess. Early intervention is always favored to prevent progression to the complicated stage. The primary treatment for appendicitis is surgical removal of the appendix, a procedure called an appendectomy. This can be performed through an open incision, known as laparotomy, or through several small incisions using a minimally invasive technique called laparoscopy. Laparoscopic surgery generally results in a shorter hospital stay, less pain, and a faster recovery. In some cases of uncomplicated appendicitis, particularly when caught very early, antibiotics alone may be used as a treatment option, but this approach is still being studied and isn't universally recommended. Post-surgery, pain medication is typically prescribed, and antibiotics may be administered to prevent infection. Following an appendectomy, most people can resume normal activities within a few weeks. Unfortunately, there's no guaranteed way to prevent appendicitis. However, some research suggests that a diet high in fiber may reduce the risk. Fiber helps regulate bowel movements and prevent constipation, which can contribute to the formation of fecaliths. While more research is needed in this area, maintaining a healthy diet with plenty of fruits, vegetables, and whole grains is generally beneficial for overall health and may potentially lower the risk of developing appendicitis. The prognosis for appendicitis is generally excellent, especially when treated promptly. With timely diagnosis and treatment, most people make a full recovery without any long-term complications. However, if left untreated, A ruptured appendix can lead to serious complications such as peritonitis and abscess formation, which can require more extensive treatment and prolonged recovery. Recent research has focused on optimizing antibiotic therapy for uncomplicated appendicitis and refining surgical techniques to minimize complications and improve patient outcomes. Ongoing studies are also exploring the role of gut microbiome in the development of appendicitis, potentially paving the way for new preventive strategies in the future.